Hello everybody and welcome to the Tuesday edition of Video Clips, and we'll just start with a couple of announcements. This week on July 16th we're going to be posting the next workshop on the members site, Cooking with Chef Del Creative Wrap Making. I think we've all fallen in love with wraps here at the Wellness Forum, and there's no limit to the stuff that you can put in a wrap, and this guy really has great ideas, not only about wraps but about everything. We know that, right? And then next week, quick and effective workouts for weight loss with Chris Dorka. That's next week's workshop. The next Ask Dr. Pam session is tonight, so if you're watching this and you want to be part of it, get in touch with the office right away. And Food Over Medicine certification course starts on Thursday. We have a lot going on at the Wellness Forum these days. And don't forget about Advanced Study. The next session of Advanced Study is Monday, and that's the second part of Shannon Brownlee's really amazing book called Overtreated: Why More Medicine is Making Us Sicker and Poorer. All right, that's a whole lot of stuff. No wonder I get worn out sometimes. I'm teaching my rear end off here. All right, so let's get into today's topics. I want to talk about Caldwell Esselstyn. You know that Dr. Esselstyn's one of my favorite people. His work with dietary intervention in coronary artery disease patients is amazing. There are several things that make his research different. One is, and I'm very grateful for this, he really showed the effect of diet by making his program quite uncomplicated. Just eat the right foods and the disease will stop progressing, and in some cases he showed reversal. Doesn't mean he doesn't think other things are important like exercise, and he serves as a great example. He's really physically fit and in amazing shape, and he's an aggressive athlete even at his age, so it's impressive. He leads by example. But he was able to show how truly powerful diet was. That was the only thing involved in his intervention. Another thing that's amazing is the length of time that he followed up with his patients. You know, it's not unusual. In fact, I would say it's the norm to see studies where patients are evaluated and looked at for a few weeks or maybe a few months. But he's followed his patients for almost 30 years. And in view of the fact that sometimes short-term results are not predictive of long-term health outcomes, this is really a very important thing. Because his patients not only got better in the short term, but they got much better in the long term. Dr. Esselstyn, however, has been criticized because his initial patient group was so small, 24 patients, only 18 of them were compliant. And I have always said that there are two things about his critics. One is their criticism of the study shows somewhat their limited ability to understand statistics. And without going into a primer on statistics in this broadcast or in the article that I'm going to post on it, let's just say that the odds that his results could be due to chance are about zero. The other thing is that a lot of these critics are people who promote an animal foods-based diet, and they find people like Dr. Esselstyn and Dr. Campbell a real thorn in their side. But Dr. Esselstyn has now delivered a marvelous gift to all of us who promote plant-based nutrition and his work, which is an additional article in the Journal of Family Practice reporting the results of more patients. And here are the details. The article reported the results of 198 consecutive patients with diagnosed cardiovascular disease, and they were taught how to eat a diet that eliminated all dairy, fish, meat, and added oil. Out of the 198, 177 were compliant, almost 90%. So again, we see evidence that addresses the myth that people just won't do this diet and they won't stick with it. Well, 90% of his did, so apparently people will do the diet and stick with it. There was only one stroke reported in the compliant group, a rate of 0.6%, significantly less than what's reported in the general population with coronary artery disease. Of the 21 non-compliant patients, 13, or 62%, experienced adverse events. In other words, big difference between the people who stayed on the diet and the people who didn't. And what's even more important from a clinician standpoint is that the data are not only statistically significant, but represent meaningful difference in the lives of the patients. Now, meaningful difference is a term that Dr. Campbell used in his book, Whole, Rethinking the Science of Nutrition, when he was talking about that what patients really want is better health outcomes, not just changes in biomarkers or slight reductions in symptoms. I mean, they really want change, and that's what Dr. Esselstyn has delivered. The article concludes with this comment, and I'm just going to read it to you because I think it's better than if I paraphrased it. In summary, the present cardiovascular medicine approach, tested beyond 40 years, can neither cure the disease nor end the epidemic and is financially unsustainable. The safety, diminished expense, and prompt, powerful, and persistent results in treating the cause of vascular disease by whole food, plant-based nutrition offer a paradigm shift from existing practice. We think the time is right for a controlled trial, but in the meantime, the data are sound and strong enough that patients should be informed of this option. And boy, that's what my work has been all about. Informed consent. At least know the options before you choose. Couldn't agree with this more. And yay for Dr. Esselstyn. All right, while we're on the subject of dietary interventions, let's talk about some pesky little issues that sometimes complicate dietary interventions. And this message is for clinicians as well as the lay public. But I think a common myth, I'm just going to start by saying a common myth, and I hear people talking about it all the time, is if there's anything we need in healthcare, we need more research, and we just throw more money at the problem. More money, more research solves everything. And, and particularly on our side of the table, if we had more money and more research and we could have our plant-based way, we would show the world that everything is great with plant-based nutrition, it all works, and we all live happily ever after. Now, I am a big fan of plant-based nutrition. I personally eat a vegan diet. We teach a plant-based, but not vegan diet here at the Wellness Forum. But I think we have to be careful, coming back to the topic at hand here, of how we spend money and resources and the types of research and findings that we report to the public. Almost everyone agrees with the idea that weight loss and other lifestyle modifications can prevent type 2 diabetes. The question is what you do with that information. Community and government-sponsored intervention programs have been used in a lot of settings, some with success. But according to one researcher, the potential benefits may be great, but the cost may also be great, more than we actually can justify spending. According to Richard Kahn, PhD of the University of North Carolina at Chapel Hill, it may be unfair to ask society to pay for these programs due to both the expense and the fact that they are not completely effective or their efficacy is unclear, and I'll explain what he means by that. He recently wrote about this issue in Diabetes Care and shared some of his insights in an interview that was posted on Medscape. His concerns include the types of interventions that have been used for preventing type 2 diabetes, which have included an extraordinary amount of personal attention, for one thing. In some studies, the patients were called, telephoned, emailed, they had in-person meetings, they were often given free food, health club memberships, cooking classes, support groups, and almost anything needed in order to learn and continue to practice better health habits. Kahn says that this isn't the way that real life works and calls into question the results achieved. He also expresses concern about weight loss, which I think we all agree is a major thing in preventing type 2 diabetes. The problem is that a lot of studies report initial weight loss, and the recidivism rate with weight loss is really, really high, which means that the effects may not be long-lasting, and he indeed reports that in studies that have followed people for 1 year, patients were regaining their lost weight, which would negate the reduction for risk of type 2 diabetes. Researchers tend to report their results in these types of trials as if they're permanent, when that's most likely not true. And he says if you take a look at the cost of the interventions, they were all expensive. Kahn says that for diabetes programs to work, they have to cost less than $200 a person, and weight has to be sustained for a 4%. Weight loss has to be sustained at the rate of 4% for 30 years. Now, there's one area where I take issue with his findings. He claims that people are inaccurately told that it's inexpensive to maintain healthy habits, and he disagrees with that. I disagree with him. We've done numerous analyses on the habits, eating an optimal diet, for example, and exercising, and it's much cheaper to eat well than it is to eat the standard American diet. And when you take care of yourself, the savings in terms of medical expenses and healthcare are significant. So I don't agree with him that patients are misled about the cost of ongoing participation in healthy eating and exercise. Kahn's not suggesting that clinicians stop telling patients to lose weight or improve their health. He is suggesting that perhaps it's not the right thing to ask society to pay for the types of interventions he's evaluated. And I think the take-home point for all of this is that we have to be really careful if we want to change the world. And boy, that's why I'm sitting here and I come and talk to you every week. We have to be really careful that we do things that are duplicatable in real world. And that is one thing I want to say about Dr. Esselstyn's study. And maybe to tack on to what I was talking about before, his patients came to the Cleveland Clinic, and yes, some of them had to travel there, but the bottom line is that he and his wife spent an afternoon with them. It's a 5-hour program. And then they went home and they did it. That's not expensive, okay? That everybody can do, and we could make arrangements for lots of people to participate in something like that. So I don't want to be critical of programs out there. Anybody who's spreading the word about plant-based nutrition, my gosh, I just want to go up and hug them and thank them for what they do. But I do think that we do need to be mindful as we go forward and do things with the hope that other people will latch on to these ideas and run with them, that we do things that will work in the real world. And that's why we do what we do at the Wellness Forum. Membership is very inexpensive. We teach people in real life settings where they go back to their negative family members and friends who aren't on board and learn how to do this and go through the struggles that you go through when you're just starting out, because we think that that's our best option for helping the most people. All right, that's all for today. I will be back to you again on Thursday with more news. And in the meantime, please pass this on to anybody who you think would enjoy watching it.